Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Yahin Filus. My presentation is devoted to a famous Muslim scholar, Razi, and the topic of the presentation is Razi, a review of ideas and practice in medicine and mental health. Today's agenda is next. First, there will be introduction, then we will go to biography of Razi, then we go into details of his medicine and his ideas on mental health and psychology, and then conclusion. First of all, introduction. During the golden age of the Islamic civilization, that is 7th and 13th centuries, many fields of science were highly developed, including medicine. The Islam world of that time got great achievements in almost all branches connected with health science, namely medicine, pharmacy, surgery, nursery, and so on. What provided that? Islam calls for a healthy society where everybody can promote all his physical, mental, and spiritual faculties fully. The Holy Quran gave general guidelines and rules on nutrition, cleanliness, martial relations, child rearing, etc. And for example, one ayah from Quran, and made your sleep for rest, and made the night as a covering, and made the day as a means of subsistence. Al-Razi, his full name is Abu Bakr Muhammad ibn Zakaria al-Razi. He lived in 9th and 10th centuries. So he was very much inspired by teachings of Islam, and he is a distinguished scientist, physician, and he influenced on both the Muslim world and Europe. General information about Al-Razi. He was born in Khorasan, the city of Ray, and so that's why he called Razi, and in West he known as Razes and Al-Bubator. He's a prominent medical scientist. He was known as the Arab Galen. We can call him the most innovative and of all the Muslim physicians, along with Ibn Sina, and he influenced the world of medicine up to 17th century. He was a master of prognosis and psychosomatic medicine. He was superintendent in the hospital of Baghdad for a long time. He wrote 237 books, and about 40 of his manuscripts are still extant. He was a polymath. Despite medicine and pharmacy, he wrote books on physics, mathematics, astronomy, and optics, philosophy, and religion. Some facts from his biography. He studied philology, mathematics, philosophy, logic, chemistry, and music, but as his 30s he devoted himself to medicine. He traveled to Baghdad to study medicine, where he learned from a well-known physician, Ali bin Sahab. Received patronage from Abu Salih al-Mansur. He was the governor of Ray, managed a local hospital there. From Ray, Al-Razi went to Baghdad during the Caliph Muqtafi's time, and also he directed a hospital. After Muqtafi's death, Al-Razi came back to Ray, where he gathered around him many students. Presumably he died in 224. Some facts about his personal traits and worldview. He was ascetic, generous towards his patients, and charitable to the poor, so that he used to give them full treatment without charging any fee, and even stipend. He was a rationalist, extremely confident in the power of reason, free from every kind of prejudice, and daring in the expression of his thoughts. He was an independent thinker and not afraid to rely on his observations when they contradict the past. In teaching, Razi would deal only with patients whose condition perplexed his students. It is also known that he suffered from eye problems and a hand injury from copious reading, copying, and writing. And we can name here some of his major works. First, we should mention Kitab al-Nawi fi al-Tib, comprehensive book on medicine. Al-Shakuk ala Jalinus, doubts concerning Galen. Kitab al-Mansuri fi al-Tib, Mansur's books. It was devoted to the governor of Razi. Kitab Daf Madar al-Aghiya, book on repelling harms caused by diets. Kitab al-Judri wal-Hasba, book on smallpox and measles, and the spiritual physic. First book that we should mention is Kitab al-Hawi. We can call this book as magnum opus, comprehensive book. It contains an astounding mass of extracts from Greek, Arabic, and Indian literature, as well as numerous records from his own medical practice. Al-Hawi contains the thoughts, original observations, and clinical notes of his entire medical life. This encyclopedia of medicine was used as a textbook in numerous European universities for 500 years, from 12th to 13th century. During this period, Galen, Razi, and Ibn Sina were considered the giants in the field of medicine. His valuable book, Kitab al-Mansuri, comprised of treatises in 10 volumes, was dedicated to his patron al-Mansur. The first book was on anatomy and physiology, second book was on temperaments, third book on simple remedies. The fourth book treats of the means of preserving health. The fifth book is given to a consideration of skin diseases and cosmetics. The sixth book is on diet for travelers. The seventh on surgery. The eighth book is on poison. The ninth, the most influential in the Latin West, is devoted to a consideration of the various organs of the body from top to toe. The 10th and last book is given to a study of fevers. Some words on characteristics of Razi's medical practice and methodology. First of all, we should mention empiricism and original observations as the basis for his method. Clear-cut clinical descriptions of illnesses. Pragmatic and holistic approach to diagnostics and treatment. Great care upon diagnosis and prognosis. Dialectical approach to theory and practice. Regular checking theoretical knowledge in practice and comparing records in patients' medical histories with the data reflected in the scientific literature. Call for medical specialization. His phrase, "One doctor can cure all diseases," is well known. And I'd like to present two interesting cases from his practice. Razi has his own original way of determining the most suitable place for building a hospital. In different parts of the city, he hung pieces of meat, after which he observed for several days where it did not decompose for a long time. The scientists considered this place to be the best. Razi was called to treat a famous ruler who was suffering from severe arthritis. He advised a hot bath, and while the ruler was bathing, Razi threatened him with a knife, proclaiming he was going to kill him. This deliberate provocation increased the natural caloric, which thus gained sufficient strength to dissolve the already softened humors. As a result, the ruler got up from his knees and ran after him. So he was cured. And some blocks and parts of his medicine. First of all, I would like to draw your attention to his ideas on diets and nutrition. These ideas mainly are placed in his Kitab Daf Madar al-Ariya. It has two sections: methods and means of getting rid of the harms caused by foods, and the second one is on the consumption of suitable balanced diets. Main ideas: it is better to use appropriate foods instead of drugs as the first line of treatment. The use of drugs should be reserved as the last option. Dietary regimes for weight gain and weight loss. So his ideas are quite applicable at our time. The second block, infections and sanitation. In Kitab al-Mansuri, he observed how airborne germs can cause infectious diseases, leprosy, scabies, consumption, and epidemic fever. It was a great idea for 10th century. In every illness which has put refraction and bad air, one should distance oneself from the afflicted or seek upwind from them. Razi was among the first to recognize the need of sanitation for infected patients in hospitals. He used cotton in the prevention of wounds in smallpox patients, elaborated different drugs for infectious disease. These are only some of his ideas on sanitation. One of his discoveries is differentiation of smallpox and measles infectious diseases. His work Al-Judari wa Al-Hasba is totally devoted to these diseases. For centuries, this book has remained a masterpiece of direct observation and clinical analysis. Razi's differentiation of smallpox and measles is almost equal to the diagnostic criteria of modern medicine. Razi managed not only to classify the type of infections based on location and time of the appearance of the symptoms in these two infections, but scaled the degree of severity and prognosis of the infections according to the color and location of rashes. He indicated the cause of smallpox was by yeast and transmission via blood. This idea is close to that is known today. Also interesting his ideas on urology and chirurgy. He differentiated kidney calculus symptoms from colonic pain. His recommendations for the prevention of kidney calculi are quite applicable to today's clinical practice: avoidance of hypercalciuria and increased saturation of the urine. His innovative method of surgical removal of the bladder calculi reached Europe and remained the procedure of choice until early 18th century when the present suprapubic method was introduced. And he is also well known with his ideas, with his practice of curing gout. Razi mentioned that gout is a chronic and complicated disease which needs a long-term treatment and holistic approach. He proposed that one of the best medications for this disease is Colchium autumnale. It's in Latin. It is a plant that is used in medicine. Though it is less common in women and children in comparison with men, but so he analyzed the statistics, medical statistics. It shows his empiricism. Much more common among rich people than the poor. He also draw attention to this fact. He emphasized that consumption of any kind of meat can be prejudicial. So it's also known in modern medicine that diet and refraining from meat is one of best ways to treat gout. Al-Razi indicated that some lifestyles and habits like gluttony, hyperactivity, and drinking wine can aggravate the pain. Recent studies have confirmed his claim. Gout is associated with dietary regimes with high levels of purine and consumption of alcohol. So we go further and we will talk about his ideas and his methods in the area of mental health. Razi was the first in the world to write on mental illness and psychotherapy as a physician. Maybe there were a lot of philosophers that wrote on psychology, but as a physician he was the first. He rejected the notion of the mind-body dichotomy and considered mental health and self-esteem as significant factors that affect a person's health and well-being. As the director of the first psychiatric wards in the world, that was one of the first psychiatric wards in Baghdad, he promoted the humane treatment of the mentally ill and psychiatric, and he also proposed a psychiatric aftercare. So that was the fact that upon discharge, patients from his ward received financial assistance for provision of immediate needs. Encouraged self-analysis and awareness, feedback exchange, and reasoning that are the ideas that are used in modern psychotherapy and psychosomatic medicine. He understood the placebo effects on psychosomatic symptoms. So some facts about his diagnostics and treatment in reference to mental health. Mental disorders should be considered and treated as medical conditions. So he presented himself as a physician. He provided descriptions for mental illnesses. His books have explanations for various mental illnesses that plagued society during the 10th century, symptoms and definition, differential diagnosis and treatments for different mental illnesses. He conducted very detailed clinical observations of patients with psychiatric conditions, provided treatment with diet, medication, occupational therapy, aromatherapy, baths, and music therapy, practiced an early form of cognitive therapy for obsessive behavior. He also paid attention to a therapeutic relationship between doctors and clients, patients. He gave priority to the doctor-patient relationship and postulated that the physician should encourage and support the patient. He stated that physicians should always try to convince their patients of the possibility of improvement in their condition, as well as the hope in the effectiveness of treatment. Personally used a cheerful countenance and encouraging words to instill in patients the hope of recovery. Razi believed that physicians should be modest, soft-spoken, and gentle when communicating with their patients to ease the anxiety of receiving unfavorable news. He stressed the importance of communicating with patients on a personal level rather than simply making them aware of their illness. He considered psychology as spiritual medicine. Razi had his own views on the understanding of the human psyche and ethical principles of curing it. So, his ideas below. The sovereignty of the human mind. He stressed the sovereignty of the human mind. Although it was criticized by some Muslim scholars and some others, he also thought that a person should be ruled by reason, not passions. The soul is an eternal living substance. So he considered the spiritual medicine as the science of correcting the mores of the human soul and improving the spiritual qualities of a person. So he also stated, enjoyment is nothing but liberation from suffering. So his ideas a bit, we can say that it referred to Socrates, Aristotle, and so on. The ways to achieve pleasure are moderation, overcoming evil, submission of one's actions, deeds, and passions to reason, social activity, usefulness to society, the ability to overcome difficulties in combination with virtue and moral purity are the recipes for happiness. So, in conclusion, we would like to say the following. Through the example of Al-Razi, we see that Islam emphasizes and promotes the development of science, including medicine and mental health. Al-Razi was one of the best-known medical scientists of the Muslim world who added very valuable contributions to medicine, pharmacy, and psychotherapy. A number of his books have been published into various European languages. About 40 of his manuscripts are still extant in the museums and libraries. His contribution has greatly influenced the development of science in general and in medicine in particular. He also can be called the first psychotherapist and scientific psychologist. He was an intellectual and arguably the most innovative of all the Muslim physicians the authors even seen, and was known as the most distinguished character in the world of medicine up to the 17th century. A great number of innovations and pioneering works in medical science have been recorded in the name of Razi. Thank you for your attention. Assalamu alaikum wa rahmatullahi wa barakatuh.